Well, in an interview today, Health Minister Zweli Mkhize warned that South Africa is on the verge of a massive spike in corona cases and related deaths. Mkhize says the infection rate in Gauteng in particular has increased faster than was anticipated. To discuss if the healthcare system is well equipped to deal with COVID-19 is Dr. Anban Pillay, Deputy Director General at the National Department of Health. He joins us via video link now. So, Doctor, during a 702 interview today, Health Minister Zweli Mkhize said that things are getting particularly tough when he asked to comment about the fight against COVID-19. How tough are we talking, Dr. Pillay?
Well, you may notice that the number of cases are increasing exponentially. We initially had the surge in cases in the Western Cape. That then moved to the Eastern Cape, and we had a significant increase there. But now what we're seeing is that Gauteng is increasing quite rapidly. In fact, it's surpassed the Western Cape in terms of the number of cases. The positivity rate relative to the number of tests done is also increasing quite rapidly, which suggests that Gauteng is now moving towards the surge that the Western Cape experienced. So we now have effectively 3 provinces in some other stage of the surge process.
You mentioned Gauteng and how the numbers are rising significantly faster than you initially anticipated. How long on the current trajectory before we see the same sort of figures that we saw in Cape Town and the Western Cape at large?
The modeling team anticipates that usually it is about 5 to 6 weeks away from where you see another province having numbers that increase. But we're waiting for the latest figures from the modeling team, which hopefully will be out this week. That would then give us a good sense about where Gauteng is likely to surge and what those numbers would potentially look like when it does surge.
What are the possibilities of government instituting another hard lockdown in response to this rapid increase in infections, not only in Gauteng but elsewhere in the country?
Well, we have a toolbox of potential interventions that we can use, and a hard lockdown is certainly one of them. We would have to consider that, balancing that against all the other measures that could be put in place and how effective a hard lockdown would be in this particular context. And I think the NCCC will have to make that call. It's a difficult decision, as you can imagine. A hard lockdown has a number of negative consequences because it's a fairly blunt instrument. And so I think the NCCC will have to deliberate on that matter before making a decision as to whether we move towards a hard lockdown or not.
We entered initial lockdown with no deaths from COVID-19. Some are arguing that it lulled South Africans into a false sense of security. With this in mind, do you think that South Africans are taking this disease seriously enough? Are you happy with the compliance by citizens with the calls to wear masks in public and avoid public spaces?
I think that there is a significant proportion of the population that are certainly adhering to the advice that we've provided around protection relating to the use of masks, social distancing, sanitization, etc. But there is still a proportion of people who are failing to wear masks, are not social distancing, are continuing to consume alcohol in levels that basically put them at risk of contracting COVID as they lose their ability to make judgments about the environments they're in, etc. And we're appealing to them to amend those behaviors because they're going to have negative consequences for both them as well as their families. So the time is now for them to really have a hard look at the numbers that are coming through, the mortalities that are increasing. This may be people in your own family, and it could come much closer if we don't amend our behaviors.
Health sector unions have criticized government for not adequately preparing healthcare workers and equipping them with the tools of the trade to protect them from COVID-19. Would you admit that perhaps government was initially slow to ensure that all healthcare workers had the corrective personal protective equipment?
Yeah, I think at the point when COVID first broke, there was a massive surge in the need for personal protective equipment. At the same time, the suppliers of the PPE in South Africa were really limited in their capacity to supply. And there was a period of time when we had shortages of PPE. Fortunately, we were able to bridge that gap by bringing in significant amounts of stock with a lot of support from the Solidarity Fund and others. We've now been able to bridge that gap that currently existed, and we have sufficient PPE to go around. One of the inappropriate things that's happening is that people are not using the appropriate PPE for the level of risk for which they're managing. I think it's important to appreciate that those at the front line, those healthcare professionals and workers that are in the front line delivering the service, need the appropriate PPE to provide them with protection. Those of us that are at home, that are working in offices, not in the front line as those in hospitals, should not be using the same PPE, because I see a lot of people walking around with N95 masks. Those are masks that are ideal for people working in the front line because they require that level of protection. So I think it's important for us to appreciate some of these measures and ensure that healthcare workers have access to those types of things.
Dr. Pillay, what's your take on schools in the Eastern Cape? Premier of the Eastern Cape has called for schools to possibly close now after we're seeing a spike in infections in various public schools in the Eastern Cape. Is the Department of Health, what's your take on that decision?
Look, we were always concerned when schools opened that we were going to have this risk of outbreaks in schools, because not only are there kids in school where we know the kids may not necessarily have the negative effects of COVID in terms of hospitalization or ventilation, but the teachers in the school are also at risk. And so we anticipated that as the number of infections increased, it was going to affect schools as it would affect all other institutions within a province, and that would result in schools having to close for a period of time. I think this is what we must anticipate in terms of the way COVID-19 is going to be with us for the next year or two at least.